What tips do I have for men who are trying to decide whether to have external beam radiation therapy? First of all, I think it's important that you have complete faith in your oncologist as to what the benefits are of radiation therapy. And secondly, that you have complete faith in the technicians, the radiation technicians who will be administering the radiation therapy to you. In my case, I found that when the radiation process was underway, that there would be a couple of clicks and I'd feel a small movement. And when I asked my radiation technologist afterwards what was happening, I was told that they were adjusting the bed by 2 millimeters to make sure that they hit the right parts of the prostate that the oncologist had determined. Second, I think it's important that you be able to listen to, understand, and learn from speaking to others. And for that purpose, I suggest that you may want to consider the local prostate cancer support group in your area. I found my experience with the Vancouver-based group to be extremely valuable, and the advice I received, the information I received, provided me with an excellent basis for confirmation of my decision. Third, I think that in discussions with your oncologist, it's important to go in with a pre-prepared list of questions so that you're not trying to listen to something and learn about it at the same time. Fourth, depending on your degree, on the degree to which you want to get into the details, the clinical details, I would recommend that you study the National Cancer Communication Network guidelines, treatment guidelines for prostate cancer. These are available on the internet. Finally, I believe it important that you, when you visit your oncologist, that you go with your wife or a friend or someone who is able there also to write notes against the answers you are receiving from your oncologist. I was fortunate in having an oncologist who was very patient with a plethora of questions that I had, and a wife who was willing to act as my scribe in getting the answers down, so I was able to study them after I'd left the appointment.